Okay, welcome, ladies and gentlemen, to the meeting of the Rutherford County Benefits and Insurance Committee. We will call that to order, and I believe you have a copy of the minutes from the last meeting. Do we have a motion concerning the minutes?
Motion to approve.
Ms. Hickerson, and a second, Ms. Boney. Did anyone have any corrections or additions? If not, all in favor of that, then please say aye. Aye. Any opposed? Thank you very much. Now, Ms. Stinson, you will tell us about the financial condition.
If you go to Fund 264 report. I'm sorry, if you go to Fund 264 report, we'll start with this. For the month of December, the per employee per month is $741.06. That's compared to prior year of $827.55. When you combine the clinic experience, our total per employee per month plan costs are $769.86 compared to prior year of $856.93. That puts us overall for year to date of $744.47 on average, which gives us a trend of 15% over prior year.
And that's the full and complete report there, very abbreviated report. Any questions for Mrs. Stinson on that? Okay, we need a motion. Oh, I'm sorry about that, Ms. Harvey. Please go ahead.
I have just a quick question. Did we get any more update information about the number of people we see at MedPoint clinics? Is that on this report?
The December shows the increase in the number. You'll see that from November we were at 856 when they went back in and did total count. You can see that it moved to 1,047.
Okay, and that's because they have changed the way they're counting, that there was a kind of...
Before they were only capturing actual physician appointments, and now they're including appointments that are only for labs and those type of things as well.
Thank you.
Any other questions? We do need a motion then to approve the financial statement report. And Mr. Jordan, a second from Ms. Hickerson. Any other discussion? All in favor of that, then please say aye. Aye. Any opposed? Now we're going to look at workers' comp and OJI statistics, and Mr. Goode is going to present that, I believe.
Good afternoon. You should have your report there in front of you. The month of December, the county had a total of 16 injuries requiring medical attention. From your report, you can see the breakout of the type of injuries that they were. That brings the year's total to 239 injuries for 2011. The total recordable injuries were 169, 86 were restricted days, 30 were lost claim days, and 53 others. The next page, you'll see your graph that'll compare 2011 to the two previous years. And you see that it still does run in a cycle. We were slightly bit higher in total over last year, but we were less than what we were as far as total claim numbers for 2009. Next page, you'll see that the total incurred dollars for the month of December were $26,350. The Board of Education had a total of 10 injuries or claims. Total dollars for them were $16,800. The other six, or another six, was with the Board of Education, or excuse me, with Rutherford County Government, and that was for $9,550. And then the next page is where we broke down the county general to where those are within the county, those six injuries. Since December is the last month of the year for OSHA, I went ahead and did a year-end summary for that. Total for the year, as I said earlier, was 239 injuries. The total dollars incurred for those is $551,930. Just kind of a reminder on that, those total incurred dollars are dollars that have been set aside to pay the claim. They may not have been paid out yet. And because claims happen at the end of the month in December and things like that, we have some claims that are still open for 2011. In fact, we have 52 claims that are open for the year. And as we go through 2012, those claims will close, and those dollars, incurred dollars, will be adjusted. For the year, the Board of Education had 111 total injuries, and their total dollars incurred was $190,178. The Highway Department had 6 claims for the year, and they totaled $30,643. The County General had 122 claims, and the total dollars incurred there for the year were $331,109. And your next page shows the breakdown of those claims across the county as far as their location. Lastly, the end of the year, we're required to post the OSHA 300 log, 300A. I've attached a copy of that for you. That's been sent to the schools and to the county safety committee so that it can be posted in all the public buildings. And this is what you'll see, and it'll be posted from February the 1st through April the 30th. Are there any questions on that?
Questions for Mr. Goode? Do you see any trends here, or are we just sort of still doing the good job that we've been doing for the last couple of years?
Still doing a good job, sir. While the claims may be up slightly, that can be explained, and I believe better reporting and of course, some of the times. But we're better than we were in 2009, with claims are actually down from 2009. So I think we're right on track.
Okay, good. Any other questions on this then? Otherwise, we thank you for that report.
Thank you.
Now, Ms. Kelly was going to give us a report on our health and wellness.
Hi, good afternoon. I'd like to give you the wellness report. As you know, we are in our HRA drive for 2012 through our MedPoint clinics, and I've provided you with a copy of the email that went out to employees on the second page to encourage them to do this. The MedPoint clinics are offering walk-in times, and you can see on the grid that they're Tuesdays to get your labs, and the times are listed. They're from 7 to 11, 12 to 4. You can just go walk in there, and on Fridays you can return and get your results. After you do that, there's just a 10-minute online survey to answer just about your behavior, what you eat, how much you exercise, if you wear your seat belt. And after you complete those 3 things, then you can be entered into a drawing for a free gym membership at the new MTMC Wellness Center. We have 8 of those memberships to give away. Our Taking Charge Diabetes Support Group started last Thursday. We have 27 people enrolled in that, so we're really excited about that class. And our wellness discount for January is a 20% off package to Warm Springs Wellness. For the past few years, we've given a wellness discount card that county employees can use for the year. The vendors have given me some feedback that not a lot of people are using them, so we're going to do a different program and try month-to-month discounts this time. The HRA clinic goes on through February, and February is Healthy Heart Month. I'd like to encourage everybody to wear red on February 3rd. That's the nationwide Wear Red Day. And on February 7th, we're having a Healthy Heart Lunch and Learn at the Health Department. So would love for everybody to come to that. It's from 11:30 to 12:30. And our wellness discount for February will be 20% off boot camp for a personal trainer. Her name is Julie Wilcoxson. Anybody have any questions? Ms. Harvey?
Just a couple, and I don't know if you can answer it, or maybe we need to ask Miss Melissa, but do you know that if you're on option 3 and you go back in to get your results, will you be charged an office visit fee for that?
No, you wouldn't be charged an office visit fee if you're just going in to discuss your HRA results.
Okay. And will these results be in a report online that we can have access to like we did at Care Here?
They will provide you the lab results whenever you meet with the nurse practitioner or physician. And the online that Ms. Perrin spoke of is actually an auto-generated report immediately following completion of the questionnaire.
So you can get a copy of your report and no charge for your results visit. Anybody else? Thanks.
Okay, thank you, Ms. Perrion. Okay, well, we're moving along here very nicely. Mrs. Stinson, tell us about chiropractic benefits.
As you know, we're starting to review our plans that we currently offer to see what modifications need to be made for 2013 in terms of plans. One of the things that I think that would be appropriate to go ahead and make an adjustment to now is in regards to our chiropractic benefit. Chiropractor benefit is a carved out benefit in such that it has a number of annual visits that you can have, which is restricted to 26. It has a separate deductible of $150, and then the last thing that it has is a maximum paid amount per visit, which is $17.50. And those benefits originated over 10 years ago in our plan documents and have never been revised. The problem is the $17.50 may have been an appropriate amount 10 years ago, but it's not an appropriate amount today. It leaves a lot of out-of-pocket costs for our employees, and it doesn't really address current health care costs. So the recommendation that I'm bringing for consideration today is to keep the 26 visits in place and the separate deductible. Those are standard practices in the industry, but to remove the $17.50 limit that we have and make it payable just as our other benefits are for in and out of network.
And how would that work? I mean,
so when the chiropractor submitted, it would go against, as an in-network provider, it would go against the contracted rate that Cigna has, and it would pay at 80% for an in-network.
okay.
So it'd be the same as if you went to a private practice, you know, to your regular physician.
And do you have any projection on what might be the impact of that kind of change?
What it would result in is approximately $6 more per visit being paid by Rutherford County. And if you look at the fact we haven't increased the amount of $17.50 over the past 10 years, if you just do a simple inflation of 3%, we would be at the $6 now. And if you compounded off the $17.50, we would be well above that. As what we'd pay on the 80%. I think the 80% is cleaner. I think it's easier for employees to understand, making it be consistent with the other benefits that they have paid.
Okay, so 80% of 26, or I don't know whether you said 26.
Well, it would be roughly about, so right now we pay $17.50,
right,
and the plan would pay you about $24.
What's the wishes of the committee? Mr. Hall.
When I looked to see what it would increase for the amount per visit from our pay, I really didn't look at what the billable charge amount is. And of course, they charge based on the adjustments and how many adjustments they do and different things from a billing perspective. So I really can't answer that question, to be honest with you. Yeah. So based on the information that was given back to me, however they bill it right now, the equivalent would equal $24 if we paid it at 80% for the average visit.
So the average visit
would be 20% higher.
$30
yeah,
times
30-something.
80% is 24.
I don't have reporting because it's combined with other musculoskeletal reporting that I receive, so I don't have the chiropractor broken out to see how many on average employees are receiving, or you know how many, if anyone's maxing out on average. So you don't have a projected annual cost then? No. Correct. Right.
They're limited to 26 per year.
Correct. And the other thing to consider is that beginning in the spring of last year, Cigna began a relationship with a company called ASH, and ASH does medical necessity management. So they are actually reviewing visits to ensure that they are medically necessary. At the point that these other parameters were put in place, you didn't have a service like that. So the billing and review process for chiropractors was a little bit different, and there was suspicion of abuse in the marketplace occurring, which is why insurance companies started putting these type of limitations in. We have that protective layer to make sure that people aren't overutilizing the benefit in the in the absence of medical necessity. So we have almost a case management approach to the chiropractor visits right now, and I think that does limit our liability significantly. I would recommend that we would retroactive it back to January 1st.
And Ms. Grace?
I've had several employees come to me with concerns of their chiropractors, since we've started using the medical necessity company, since Cigna started using that their chiropractors are having trouble getting paid. It takes them about 6 months to get paid, and there's a lot of paperwork, and a couple of the chiropractors have actually quit taking Cigna because of the problems with the medical necessity company. Is there anything we can do to check into that to see if they're being unreasonable or reasonable or
So I've had a couple of those same type of situations brought to me. What happens is I'll reach out to our contact at Cigna that works on the claims and kind of coordinates things for us, and they will actually call into the chiropractor and do one-on-one training. What we often find is that it's the billing person, whoever's doing the billing at the chiropractor's office, that's still having some struggles with adjusting to the billing process. And once we educate them one-on-one, I typically don't hear back that they're having additional problems. So as you're hearing those things, it's beneficial to provide me with that chiropractic office's information so that I can have that outreach done so that we can get them educated. I haven't heard a whole lot. Now, initially when it started, there was some concerns with chiropractors in the new process, but as of late, I really don't hear that much anymore about it. So, but we'll be glad to help in those situations.
Ms. Harvey?
Is the 80% payment by the county, is that for all three options, or will it change if you're on option 3?
Well, option 3 doesn't really look at benefit type. It would be the same that it is now with the 90% structured out. Yeah.
And Cigna has arrangements with these providers. I mean, they've already worked out a contractual agreements somehow where they know what the fee structure is, et cetera, right?
It's the
Just
same.
like everything, all the other physicians.
Correct, right.
Okay, other questions? What's your wishes? She's suggesting that we make the payment structure the same as it is for all the other programs. We have an 80-20 arrangement. What's the wishes of the committee? Mr. Hall, you're making that motion, and Ms. Harvey, was you seconding that motion? Other discussion? All right, all of you in favor of that, please say aye. Aye. Any opposed? Thank you very much. Now, Mrs. Stinson will take us into some deep water here with respect to the bid review that we've had recently. So we'll let her go through that process with you.
You have a document there titled Rutherford County Government and Board of Education. We accepted bids December 20th for our medical, dental, vision, stop-loss pharmacy that we currently have with Cigna. And we received bids from Cigna, Blue Cross Blue Shield, United Healthcare, and a TPA called BAS. Other companies submitted bids, but their submissions failed to meet the bid specifications by failing to respond to all the questions and pricing proposals requested through the bid process. Those companies that were disqualified because of this included Aetna, Route 3 Benefits, Delta Dental, MetLife, and Davis Vision. And MetLife had actually provided a fully insured quote, which is why that they were disqualified. On January the 9th, actually, a subcommittee consisting of Lisa Nolan, Jeff Sandvig, Sonia Stevenson, Mary Hickerson, and Commissioner Ely met, and a review was conducted of those bids, which you see on the spreadsheet in front of you. The subcommittee reviewed the proposals for the following categories, and that included the ASO fee, the pharmacy, the stop loss, and the medical discount. If you look at the document in front of you, we have current costs with Cigna spreadsheet, which shows an annual cost of $2,790,402. The renewal bid submitted by Cigna shows $1,610,840, which is a 42% reduction. Blue Cross Blue Shield came in second with a bid of $2,164,827. United Healthcare was $2,645,785, and BAS was $2,248,443. As you can see from the financials, when you look at what our current services are, and this is duplication of our current traditional pharmacy, our individual stop loss of $750,000, and Cigna's renewal provided the strongest proposal for Rutherford County. A couple of things, or at least one important thing to point out about Blue Cross Blue Shield's bid, is that their stop loss numbers were not firm, so there could be an adjustment to what they show in their numbers. They requested claims data through the month of April before they would finalize their stop loss figures. Medical discount was an area that we reviewed, and the related guarantees were also reviewed. There are different ways that you can calculate discount. The focus for our review was what they had guaranteed in terms of the medical savings. Blue Cross Blue Shield, as you can see on this sheet, offered a higher medical discount percentage on a guaranteed basis than Cigna did. However, whenever we spoke with Cowan Benefits, who assisted us in the review of the financials, they confirmed with us that in their book of business, they see typically around a 54% discount with Blue Cross Blue Shield, and that is what Cigna has quoted close to with 53%. I contacted the town of Smyrna and the city of Murfreesboro, and in both situations they indicated that the discount that they had reported on their claims repricing was at 54% below as well. So when we had the conversation with the subcommittee, there was concern as to whether or not we would actually see the medical savings that Blue Cross Blue Shield had quoted in their bid. The subcommittee voted unanimously on the Cigna proposal, and in light of the variance that you see on the financial proposals themselves, the need for formal interviews with the carriers was waived. We've been with Cigna. They've won the last two bids that we've had. Their proposal that they have is substantially improved over what Blue Cross Blue Shield has, and it's a substantial improvement over our current offering as well. So I wanted to bring this to the committee today for consideration based on the subcommittee's recommendation to award the contract to Cigna.
And what would be the effective date of this change?
This would be July 1st of 2012.
This year. I'd like for Mrs. Stinson to give you a little bit more update, in that I'm not equipped to do that, but if you'll notice on that rebate under pharmacy there, the annual cost, and those are reductions in their basic charges. I'd like to say that Mrs. Stinson, in her experienced wisdom, requested information at a detailed level on 3 approaches to pharmacy rebating and pharmacy charges, and she's been able to expose and recover for us a huge amount of savings there. So how does that work, Mrs. Stinson?
So part of our bid process was there are different ways that you can administer pharmacy plans that have no impact to the employee themselves. It's all from an administration side, and that involves pricing and rebates. Rebates are when certain medications are distributed either through retail or mail, and the manufacturer provides a refund back to the pharmacy benefits management company, which in this case is Cigna, and typically they will share a portion of that rebate back. They will retain a part for administration cost, and then they will return a portion of that back to the employer. In the past, what we have seen is the annual cost that has been returned back was $145,000. Through asking for the different types of pharmacy administration plans, what Cigna did was there's a certain kind called transparent, is where they charge you a fee, but they return 100% of the rebate back. What Cigna did is they put that across the board for all of the different options for administration, and improved their offering to Rutherford County through that. That is why you see such a difference in the rebates. If you'll look at that rebate line, you'll see that Cigna comes in at $755,000. Blue Cross Blue Shield came in at $188,000. United Healthcare came in at $600,000, and BAS came in at $396,000.
I just wanted to point that out, and that explains a large piece of this $1 million that we're saving plus this particular year, and give her credit for allowing us to determine how we can get to these actual numbers and expose what the potential is. So that's a good result on her part. So Mrs. Stinson, you've just told us that your subcommittee has reviewed this, and y'all have, based on this, what appears to be an obvious outcome, that y'all are recommending that we renew with Cigna under the terms as outlined here. Is that correct?
Yes, sir, that's correct.
Okay, so what's the wishes of our committee?
Motion to approve the recommendation of staying with Cigna for the next, I guess it's a 3-year bid, and forward it on to budget.
And do we have a second? Ms. Grace, now discussion, any more questions? I think that's a no-brainer, Mr. Hester. Is that what you're telling us? Okay, all in favor of that then please say aye. Aye. Any opposed? Okay, thank you very much. Now, Mrs. Stinson, is there anything else you want to call attention to this schedule of meetings?
There is for you. We meet the fourth Thursday of every month. Ms. Anderson put together a schedule for 2012 so that you could go ahead and put those on your calendar. We do try to have these when, as often as necessary. There are times that we will cancel these, and we'll give you notice prior to that so that you'll be aware. But we would like for you to reserve these dates and times for the remainder of the year if possible.
Any other business that you wish to discuss? Okay, if there's no other business, we thank you very much for your attendance, and we are adjourned.